Hello and welcome to the Henry Ford Weight Management Information Session. My name is Dr. Dennis Kerrigan. I'm Director for the Weight Management Program at our Detroit and Livonia locations. The purpose of this video is to provide you with information regarding our weight management program to determine if this is something that hopefully you will find helpful as far as your weight loss journey. Now, one thing you should be aware of is that over the past several years, I've worked very closely with all the Henry Ford locations, including Macomb Hospital, West Bloomfield Hospital, Wyandotte, as well as Jackson, regarding our weight management program and really aligning our program to offer you guys the same level of high quality of care and evidence-based medicine as you would expect at any location. So with that being said, even though my video today is going to focus on our downtown and Livonia location, certainly this could apply to any of the locations. And if you are closer to West Bloomfield or Macomb or Wyandotte or Jackson, I would refer you back to the web page here to look up those specific locations so you can find a weight management program closer to you. For this video, what I'm going to discuss today is I'm briefly going to talk about the benefits of weight loss, what our program philosophy is here at the Weight Management Program, the options for you. So you get to pick, which dietary plans and how you want your care to look like, what the time commitment looks like to you, as well as the financial commitment. And I'll also talk a little bit about insurance coverage. What's the role of your provider and why that's important that your doctor knows that you're participating in this program? And then finally, what are the next steps if you decide that this may be something that can help you? So as many of you are quite aware of, being overweight is associated with many health conditions. And maybe you're watching this video today because you want to better control your diabetes or your blood pressure, or you had a mother or father who had heart disease or stroke, and you don't want that to end up happening to you as well. The good news when it comes to losing weight and changing your lifestyle is that even a small amount of sustained weight loss of around 5 to 10% can dramatically improve your cardiometabolic health. And what I mean by that is, we know that losing weight can help lower your blood sugar, help improve your cholesterol levels, your blood pressure levels, and reduce your risk for things like heart disease and cancer. And so because of that, that's why we set a minimum goal, weight loss goal for everybody who comes into our program of at least 10% of your initial body weight. So, so doing some quick math, if you're 250 pounds, that would be an initial goal of 25-pound weight loss for you. And although even though we do set goals and talk about improving that number on the scale, as I like to tell a lot of my patients, that number on the scale really only tells me what your relationship is to gravity. It doesn't tell me the whole picture. And really the reason why I've been affiliated with our weight management program for nearly 20 years now is because I've seen so many success stories. And I love talking to patients who've been able to get off their blood pressure medication, their diabetic medication, or even better yet, be able to travel again and to move better. And so, we really want to hear from you in terms of, what are your non-scale goals, okay? Because even though we want to improve that number on the scale, we want to focus on your overall health and your overall quality of life. So while you guys probably know firsthand that losing weight and keeping it off is not easy, in fact, many people who come to our program, this is not your first attempt at losing weight, and maybe some of you have been in our program in the past. The good news for each of you is that, we know that studies showed that, people who lose weight and successfully keep it off, more than 90% of them at a previous attempt failed. And while it can be discouraging that maybe you have lost 20 pounds and regained it, it's important to understand that that's an experience that we want you to share with us. Tell us what you've tried in the past, what's worked, what hasn't worked. Because really, for weight management to be a long-term success, it requires a lifelong management. And even though today I'm going to talk about different diet options that you have and how some diet plans you may lose weight quicker than others, understand that there's no quick fix. There's no easy solution. It does require hard work and rolling up your sleeves and really changing your lifestyle. And that's why we're here, to help give you the best information in terms of how to do that, and to really support you and provide accountability along your journey. And speaking about accountability, one thing that it's important for you to understand is, we one thing that we've aligned with at our different Henry Ford locations throughout Southeast Michigan is really our philosophy, and that's using the 5 pillars. And basically, what the 5 pillars mean is that there's more to weight loss than simply eating less and exercising more. Yes, it's important to have a sound nutritional plan. Yes, it's important to have structured exercise and physical activity in your weekly schedules. But again, there's a lot more to your health than just those 2 aspects. And for example, I am a strong believer that our emotions and stress play a big role in our health. And not just from the standpoint that, we know that stress can play a role in our body's physiology in terms of raising our blood pressure, or, disrupting our hormones, which can actually affect our metabolism. But even from the standpoint that, when I have patients that have a really rough day or a rough week, unfortunately, a lot of times, they don't take care of themselves. Instead of going to the gym, they may, stop at a fast food place and search for those comfort foods, or those kind of immediate, quick fixes in terms of how you feel, right? And so really, how you manage stress and emotions is really critical in terms of your long-term success. And so we want to talk to you about that, and work with you with that. It's also important to look at your environment, and not just from the standpoint of what's in your kitchen cupboard, although that's a great place to start, right? Open that up now, and what are those high risk foods that are really tempting to you that are not going to help you along your journey. So that's one place to start, but you want to broaden your sense of your environment in terms of, what does your break room at work look like? Who are the people that surround you? Because we know that studies show us that if you have people around you that are active, you're going to be active. If you have people around you that are sedentary and sitting on the couch, well, you're going to sit on the couch right next to them. So again, rethinking our environment, what can you do to help you set up for success? And then finally, accountability is important for all of us. We all need accountability, because sometimes we can be a little bit easy on ourselves, right? We say to ourselves, well, next week I'm going to start exercising again. But it helps if you have somebody there that says, hey, you said you're going to start exercising last week and you haven't. Why not? Let's talk about that. But it's also important from the standpoint of, sometimes we can be too hard on ourselves. And so you need that person to help support you and say, hey, you're doing all the right things. You just need to stick at it, and eventually that change will come. One thing I'm proud to share with each of you is, we've worked really hard over the past couple years, really kind of developing a very sound curriculum of 24 classes, or 6 weeks. I'm sorry, 6 months. That is really geared around healthy lifestyle strategies. And so these are evidence-based strategies, and what I mean by that is they're backed by science and research. And it's really to help you not just lose the weight, but lose the weight and keep it off. And so one strategy we talk about is calorie density. And calorie density has been around for a while, but we know that if you're trying to lose weight and you're hungry all the time, you're not going to be successful. So finding strategies to help with that. And so calorie density is a way of finding foods that have more water in them, okay? Because if you have more water, that carries more weight. More weight activates stretch receptors in your stomach and helps you feel less hungry. And so not just things like fruits and vegetables, obviously that has lots of water in it, and those we always encourage that, but even things that you can add water to in terms of beans or rice. And so our dietitians, our health coaches, our exercise physiologists really talk to you and work with you on strategies like this to help you set up for long-term success. So how the rest of this video is going to work here is, I'm going to go over the 3 meal plans that you can choose from. And really, to get started in our program, you need to decide on one of these 3. Now, if you're not sure, I'll give you my contact information at the end, and feel free to reach out to me, and we can talk more about, which plan might be better for you. But ultimately, you need to decide what's going to work for you. I'm also going to discuss with you what the next step would be in terms of either meeting with our dietitian, or for some of you, you might meet with our physician, Dr. Singh, who's board certified in obesity medicine. Finally, it's also going to be important for you to decide how you want to stay connected with us. So you have options in terms of meeting us face-to-face, doing virtual connection, doing classes, doing individual. So we'll talk a little bit about that as well. So the first plan I'm going to discuss with you today is known as our Fast Start plan. And our Fast Start plan is also known as a very low calorie diet because it only consists of around 700 to 900 calories a day. And you may ask yourself, how the heck am I supposed to live off of 700 calories a day? And the answer is you don't live off of the food per se, but you live off of your stored fat that you're trying to get rid of. The food that you consume actually consists of meal replacements, and let me talk to you a little bit about what meal replacements are, what they do, what they don't do. First of all, there's nothing magical in those meal replacement packets. Um, how they help you keep your calories so low is they provide structure to make it very easy to follow the plan, so you know on a specific day how many packets or of entrees or shakes or things you're going to have. But they also provide portion control, so it really helps you keep within that 700 to 900 calories that we're shooting for. In addition to doing the meal replacements, and let me just say one more thing about the meal replacements, is that the meal replacements are not just a liquid diet. A lot of times people do like the shakes because it's easy and you can take it to work or whatever, or the bars. But we also have things like oatmeal or soups or entrees like the vegetarian chili that you have here. So there's many options for you when it comes to the meal replacements that you can choose. So you don't have to choose oatmeal if you don't like oatmeal. But the other item that we promote when you're on the Fast Start plan is we want you to have vegetables. And there's a few reasons why vegetables are important. First of all, we want to set you up for long-term success. So we want you to get starting to think about adding vegetables on your plate, with each of your meals. So we also know that vegetables are very low calorie. They're very good for your body. So again, those are considered a free food. Now, the reason why we call it the Fast Start plan is because if you're on this plan, you're going to lose weight quickly. And so typically what we see is about 3 to 5 pounds a week. Over a 6-month period, you can lose up to around 15 to 20%, and that's actual Henry Ford diet. Henry Ford data. And so really, the advantage of the Fast Start plan is it helps give you some quick momentum. You feel good about seeing that number change on the scale. You start to kind of get a reset point in terms of your weight. And then from there, we're going to want to transition you to a different diet plan, which actually we'll get to the other two plans that we could do that with. But understand that this is not a long-term plan. This is usually for about 3 months or so that most patients will be on this. As far as the next meal plan that you can choose from, that plan is known as our combo plan. And as you might guess, it's a combination of both meal replacements and some grocery items. And so, the items that are now added to the combo plan that you didn't have with the other Fast Start plan is now you can have fruit, so up to 1 or 2 servings a day. Some dairy as well, which usually comes in the form of low-fat yogurt or low-fat cottage cheese, something along those lines. And 1 meal a day that you choose. And so for a lot of people, especially the moms out there that work during the day and prepare meals in the evenings for their family, they like this plan because you can do the meal replacements during the day plus the fruits and vegetables. And then in the evenings, you can prepare 1 healthy meal for your family. Now, the 1 meal a day, you can set up to whichever meal you want. And also, for a lot of people, when you begin the plan, we encourage that 1 meal to be a frozen entree just from the standpoint that we want to keep, things simple for you. And so our dietitians will give you options in terms of what to look for in terms of that frozen entree, but you get that from the grocery store, and as long as it's under a certain sodium level and fat level, then you have a lot to choose from, in terms of that. But with the combo plan, because the calories are a little bit higher, somewhere around 1,000 to 1,200 calories, the weight loss is going to be a little bit slower than the Fast Start plan, but typically we can see about 2 pounds a week, or about 10 to 15% at 6 months. Now, the final meal plan is known as our whole food plan. And the whole food plan is the ultimate plan for anybody that comes into our program because, again, we want to set you up for lifelong success. And so this plan is very individualized. This is a plan that you and the dietitian work on, and it's going to be customized based upon your likes, your dislikes. If you're trying to avoid certain things like maybe gluten or dairy, the dietitian can talk to you about that as well. But essentially, it's going to be a low calorie, low fat, low sodium plan that you can sustain for the rest of your life with, again, lots of fruits and vegetables. Now, because this plan, there's so much to choose from, and we are creatures of habit, it's hard to go from one way of eating to another. Weight loss tends to be a little bit slower for most people who do this plan. So typically expect to see maybe a pound a week of weight loss. But a lot of patients start off, do this plan, and they are very successful. And again, this is the ultimate plan that if you start on the other two meal replacement plans, we want to transition you eventually to this plan. So this slide here talks about the program and kind of the structure of the program, what you can expect, if you sign up for weight management. And as I mentioned earlier, for any of you that are interested in the Fast Start plan, your first visit would actually be with our board certified physician in obesity medicine, Dr. Singh. And she would meet with you mostly to go over any medical concerns that we need to be aware of before we start you on the Fast Start diet. And so an example would be if you're on blood pressure medications or diabetic medications, she's going to talk to you and your doctor about adjusting those medications, because if you're losing a lot of weight quickly, you're not going to need to be on all those medications. So that's the good news. Now, with Dr. Singh, she typically sees patients out in our Canton location, or we can set up a video visit to see her. But that would be the first step. And also understand that Dr. Singh's visit is billed separately from the weight management program. Your insurance would cover Dr. Singh's visit like they would any other physician visit. So you can call us if you have any questions with respect to that. As far as getting started with the actual diet plan and program, regardless of which of those plans you choose, your first visit is going to be a face-to-face visit with our dietitian for 60 minutes. Now, we can do virtual visits if you need to, although we strongly encourage a face-to-face visit because we feel like you get a lot more out of it when you're right across from the dietitian. And what he or she will do is kind of teach you about that plan, get you started, and then talk to you about your follow-up options. Now, the first follow-up option actually will be a 30-minute visit with our exercise physiologist who will prescribe to you an exercise program. And if you're already doing exercise, that's great. He or she will help modify that. We do have an exercise class as well that you can attend, which is separate from weight management, and we can always talk to you if you're interested in that. But after you meet with the exercise physiologist, then you have a choice of regular follow-ups either through our weekly group classes, and currently this is through WebEx. And as I said, if you're interested in the whole food plan or the combo plan, I strongly recommend that you come to our weekly group classes because you get a lot of information. It's going to help you, set you up for long-term success. You also have the option of calling in and meeting with our health coaches every other week, and this could be either a video visit or this can be done over the telephone. So that's an option. And as I said earlier, we can come back and do more visits with the dietitian or exercise physiologist. That's usually going to be individualized based upon where you are in your journey and if you're ready to transition to another plan or you need a refresher as far as the plan that you're already on. So with respect to the cost of the program, I'm going to start by explaining what the out-of-pocket cost would be. So if you have no insurance coverage, and unfortunately, if you have Molina or Medicare or Medicaid, for the most part, those insurances will not cover weight management, unfortunately. But your cost would be $257 for 3 months, and this covers the dietitian visit, the exercise physiologist visit, all the follow-up. So you get a lot for that $257. If you're interested in doing the meal plans or the meal replacement plans, understand that that's an additional cost. And even if you have insurance coverage, insurances do not cover the cost of meal replacements. They consider that just like buying groceries. And so if you choose the Fast Start plan, on average, our patients pay around $70 to $100 a week on the meal replacements. Now, keep in mind, if you're doing the meal replacements, you're not going to the grocery store as much, right? And we know how expensive groceries are, or going out to restaurants or takeout. So for a lot of people, it actually saves you money. If nothing else, it's cost neutral. So always keep that in mind when you're thinking about the cost of the meal replacements. The combo plan is going to be less expensive because you're only going to have usually about 4 meal replacements a day. So your price is going to be closer to $40 to $60 in that range. For everybody who comes into our program, we have a $50 starter fee. Now that is actually taken into account for people who are paying out of pocket, so you don't pay anything more than that $257. But if you have HAP or HAP Senior Plus, those two plans actually cover our program with the exception of the starter fee. So the starter fee again is that's $50. So if you have HAP or HAP Senior Plus, you'll pay that on your first visit. But after that, the cost of your program should be nothing, up to a year. And the good news is, even if you've been with us before or been in other weight management programs, HAP used to have a once in a lifetime coverage, and they have since waived that. So that's good news if you have HAP or HAP Senior Plus. You should also be aware, if you have HAP or HAP Senior Plus, that if you have a deductible, you may have you may get bills for the dietitian visits or the health coach visits until your deductible is paid off. So be aware of any deductibles you might have or copays. But if those are paid off or you don't have any copays, then for most people, your cost should be only that $50 for the whole year. For individuals who have Blue Care Network or Blue Cross Blue Shield, the cost for you for the first 3 months is $176, and that's because for most of you now, we do want you, if you have Blue Cross Blue Shield, to check this. But many of these plans do cover the dietitian portion of our program, so your cost would be less, $176 for the first 3 months. For additional 3 months, the price goes down. HAP or HAP Senior Plus, there's no additional cost for you. Blue Cross Blue Shield or Blue Care Network, it's an additional $126. Or if you're paying completely out of pocket, your price goes down to $176. So you can keep it going, and it's a little bit less for the next 3 months. Now, if you don't want to pay up front, if you'd rather do a payment plan, you also have the option of paying $75 a month for our program. Just that's another option for you if you want to do that. Now, keep in mind that if you do the payment plans, for example, if you're doing if you pay out of pocket that $257, if you do the payment plan instead, your total cost will be a little bit more, $300. Although that again, that is broken up throughout 4 months. So you have that option if you would rather do a payment plan. If you do choose the payment plan, we will need your credit card information because this is something that's automatically billed to your credit card each month. All right, I'm almost done. I have 2 more slides here, so thanks for your attention and listening to the presentation today. This slide is important because it kind of goes through kind of the terms and conditions, things that you need to know about the program before you sign up. First thing is we need to see you. People who come to our program regularly, they do tremendous, okay? People who don't, they don't do so well. And so in fact, if we don't see you on a regular basis, we will discharge you from our program. And that doesn't mean that, if you miss, you're automatically kicked out one time, or if you can't make it, just let us know in advance. But attendance is important, and it is linked closely to success. The meal replacements have ingredients, so if you have any food allergies or sensitivities, things you're trying to avoid, make sure you talk to the dietitian before you get started so the dietitian can direct you and tell you which meal replacements to take or not to take. So that's very vital that you give that information to us before you get started. Number 3, even though we talked about some insurances like HAP that could cover the program, it's ultimately your responsibility. So make sure you are aware of what your insurance covers and what it doesn't, because if we bill your insurance and they don't pick up the cost, that goes to you. Number 4 is if you're doing the self-pay, that you will be responsible to pay at the time of your very first appointment. So when you come in to see that dietitian, not Dr. Singh, but when you see the dietitian, you're going to pay that $257 or $176 if you have partial coverage, or you're going to do the payment plan. So, but that is required to be paid at the time of the first appointment before you go and see the dietitian. Number 5 is we prohibit the use of meal replacements outside of what we prescribe. So, we work with a company that ships meal replacements directly to your house, so that's convenient. Or we do provide meal replacements here at our location, so you can purchase it here or you can have it shipped to your house. But if you're trying to go out to Walmart or Costco's and get their meal replacements, we will discharge you from the program, because unfortunately we don't know all the ingredients in all those meal replacements that are not affiliated with the ones that we use. Number 6 is, even though we will do everything in our power to help you lose 50 pounds or however much weight you're trying to lose, we cannot guarantee you, if you don't achieve those results. So no refunds, unfortunately, if you don't lose the weight that you expect to lose. Number 7, similarly, we don't give any cash back for any meal replacements that you don't like. The company we work with has a great policy where if you call them and say, hey, I ordered these chocolate shakes and I don't like them, they'll ship you the mocha or vanilla shakes, free of charge, for that same amount. So at least, hopefully it will allow you to try new things. And if you don't like them, they can ship you something, hopefully, that you do like. Finally, it's important that your primary doctor knows that you're participating in this our program. As I said, if you see Dr. Singh, she would contact your physician, or I might contact your physician to talk about, the medications that you're on, or if any adjustments need to be made. We do require some blood work if you're on the Fast Start plan too, to make sure that everything is safe with that. So your doctor needs to be aware that they're in this program. So if you don't have a referral from your doctor, you need to get one. If you have a Henry Ford doctor, it's super easy. You just call your doctor, send a MyChart message, and then they can send us electronically a referral within 5 minutes. So it's super quick. If your physician is outside of Henry Ford, then on the web page where this video is, you can just click on the referral form, print it off, and give it to your doctor and have your doctor fax it over. So again, if we don't have a referral, we can't get you started. So that's the most important first step for you. Once you have the physician referral, your next step is really for you to decide which of the 3 programs is going to be best suited for you. And unfortunately, you can't make an appointment with our dietitian and talk to the dietitian and ask which plan. You need to know going into that. So when you call, they're going to ask you which of the 3 meal plans. Now, if you're not sure, feel free to reach out to me. I'm happy to talk to you. My best contact is through email, as you can see on the screen here. If you decide, you know which plan you want, then you can call our 313-972-1919 number, as you can see on the screen here, and we can set up an appointment either in our Livonia location or our Detroit location for you to get started. As I said earlier, if you want to do the Fast Start plan, you will need to meet with Dr. Singh, and so someone from Dr. Singh's office will contact and set that up for you after you give us a call. So that's basically how that process would work. So at this time, I'd like to thank you very much for your attention, and considering the Henry Ford Weight Management Program. As I said earlier, feel free to reach out to me, and I wish you the best of luck with your health goals.